Once your dog becomes a senior, geriatric checkups are an essential part of keeping him healthy. So this is Sammy. He's, how old is Sammy now?
About 9 years now.
About 9 years now, good. Okay, so he's a senior dog.
Yep.
How's he been doing?
Good.
Good, no problems or concerns? Okay, appetite's good and
Yep.
activity levels all good?
Yeah.
Okay. All right, well we're gonna start a physical exam just by looking at his overall body condition and feeling his chest. I'm gonna feel the abdomen. And so we're gonna look at his eyes and his nose and his ears for any signs of any kind of discharge. And then I'm going to get my ophthalmoscope and we're going to look at his eyes a little bit closer, checking to make sure that response to light is normal and looking for any evidence of cataracts. And then we're going to look at the back of the eyes of the retinas. Good boy, good boy. Making sure they look good, and they do. So you want to lie down, there you go. And then we're going to come back to his ears again. And we're going to use the otoscope to look down and look in his ears, making sure that his eardrums look good and looking for any signs of problems in the ear, any discharge, and his ears look good. And then we'll come back up here and we're going to take a quick peek in his mouth, and we're going to look at his gum color, making sure it's nice and pink, and also looking at his teeth and the gums again for any signs of any dental disease, any tartar, any gingivitis, any growth or anything like that in his mouth. And so we're just going to listen to the lungs again and making sure they're nice and clear. And listen on this side too for the different areas of the heart. So now that we've finished our physical exam, now what we're going to be doing is doing some laboratory tests. We're going to be checking a complete blood count and a full chemistry panel and electrolyte panel to check his organ system function. If we'd run into any problems in the physical exam or any areas of concern, then we'd also be doing some other more extensive blood tests and maybe an X-ray or an ultrasound or some other diagnostic procedure.